Hi, my name is George. I'm a third-year medical student from McMaster. My colleague, Thrmiga Sathiyamoorthy, is a fourth-year student at UofT who's not able to join us today. And then this is Dr. Stephanie Zhou, a family and addictions physician based out of Toronto. We're here today to talk about our financial wellness conference and how we sort of developed it and where we're going with it next. So in terms of our conflicts of interest, we have no conflicts of interest to declare. In today's agenda is we're going to talk about why there's a need for financial education conference in general, what the kinds of gaps in knowledge that exist, how we've created this conference, and what our impact and future directions are going to be like. I'm going to hand it over to Dr. Zhou.
So why do we have a need for a national financial conference? Well, there's been a growing demand for financial education across all levels of medical training that is physician-led and represents a diversity of backgrounds. So when you look at medical students, there is a variety of time versus budget dedicated to financial literacy curricula. Some schools have it, some schools don't, and then other groups might be sponsored by industry, which can create a conflict of interest. Furthermore, when it comes to resident financial curriculum, there used to be a national practice management curricula for residents. However, this ended in June 2023, so currently there is a gap for this. And then when it comes to financial education for staff physicians, conferences do exist in the US and Canada, but the price can be quite high, which might be a barrier for new physicians who are still paying off their student debt. And furthermore, when you look at financial literacy and the impact on equity, mental health, and specialty choice, that does have a big impact on a trainee's mental health and human resource planning. So when you look at the levels of debt for medical students pre-pandemic, there is that bimodal distribution of those with high levels of debt and those with no debt. And this creates an inequity because those with no debt actually have a higher exam pass rate than those with higher debt. And rural students in particular have higher levels of financial stress. So not only does this create detrimental impact on mental well-being, but it can also lead to declining interest in lower earning primary care paths, which are further amplified in equity deserving groups. So when we did a literature search on how to create an effective personal finance educational intervention, we found that core financial curricula covered debt management, retirement, budgeting, and investing in the literature. However, children's college planning, contract negotiation, and estate planning were covered in fewer curricula. But this still gave us ideas as possible topics to cover in workshops. Studies have also found that having physicians who are financially literate themselves teaching the content was strongly favored, as this allowed for unbiased instruction, and having younger generation who were previous program participants were a pipeline as new instructors. So this is why we had an emphasis on having our conference team consist of students and residents. And then finally, when it comes to curriculum delivery, people preferred a concentrated and asynchronous format, which is why we chose a virtual conference as our platform. And so based on these findings, we developed the Canadian Physicians Financial Wellness Conference, or PFI conference for short, with the aim of providing evidence-based and unbiased physician education in a format that represented community engagement, as well as additional social impact in that our proceeds would go to charitable causes. The systematic review of other financial literacy curricula also informed our conference content that covered topics from both personal finance and financial wellness. And we got our learners engaged quite early on and involved in their personal finance education, as we are all learners, regardless of whether you're a med student or a staff physician when it comes to personal finance. We also drew from a diverse group of speakers who are industry experts, physician experts, as well as students who have started initiatives in financial wellness. And the diversity of our speakers is represented in our audience and in our impact, which George will talk about next.
Yeah, so as we mentioned, what we really wanted to do was strive to get and reach out to folks at every level of their education. So back in 2021, we're seeing a swath of folks, everyone from medical students to folks that are now retired and some folks that are not even in medicine, but maybe they have a partner that's in medicine. In 2023, we had a concerted effort to try to get more representation from early trainees. So this includes medical students as well as residents early on. And so you can see that the numbers begin to sort of flatten out and have more distribution across a swath of periods of training. We continue to see representation at different sort of levels. We have a majority female identifying community of folks that are joining us. And we're also seeing that a lot of folks are joining us from diverse area communities. So about half of our folks are coming from cities that have between 500,000 to over 1 million, but another half also are coming from communities that are much smaller, including 6% from communities that are 10,000 people or less. So when we decided to do this more concerted effort last year to reach out to a broader diversity of medical trainees, we continue to have a broad representation of folks. So we still continue to have about a 63% female identifying population, and we're still seeing people coming from a diversity of various sizes of communities, while at the same time having more representation from medical students as well as residents. So we are continuing to try to reach out to all parts of Canada as much as we can. So as you can see on the left-hand side, the majority of our folks are joining in from Ontario, about 400 people there, and then from British Columbia, about 165, and then a lot less from Alberta, Quebec, and then finally the smaller maritime provinces. But we are beginning to sort of reach out. We had 2 folks from New Brunswick and 7 from Newfoundland, and that's an area that we're continuing to develop and grow in. We offer a variety of ways that people can join us. So we do the actual virtual conference itself, and we also record those sessions and post them online. So about just under half of folks are actually attending the sessions live, and then another half of folks are pretty much either sort of doing a mix where they're doing some of the live sessions, and then some folks are watching it, and some folks are just tuning in for the recordings after. Now, we try to track and better understand how people are perceiving the conference and how effective it is. On the left-hand side, you can see that we've graphed out our rating. So we asked people to rate it, how much they would recommend it, from 1 being like the lowest recommendation to 5 being the highest recommendation. And we're seeing a majority of folks are finding the highest recommendation, and then a few more that are around the 3, 4 level. We asked how valuable they felt that the discussions were to promote their learning, and the majority of people are saying that basically they were learning something new, and then the minority of people are saying that they may not learn something new, but they've reinforced their learning. And so far, nobody has said that the conference was not valuable to them in some way.
When we did a thematic analysis of the different feedback that people wrote to us in our evaluation surveys post-conference, we picked out several themes on what people liked and what people wanted improvement on for the conference. So people really appreciated the mentorship that came from being at a conference like this, where people can ask people in the chat or in the Q&A and answer questions, and also hear from their fellow physician experts. People also liked that we were unbiased and that our speakers had minimal commercial biases. And finally, people also like that this was as an asynchronous conference, people can also watch it on their own time as well. They got an agency to choose which workshop they felt was more valuable to them and attend that particular workshop in the breakout rooms. I guess people also really appreciated that the tickets were tax deductible, and that as a philanthropic conference, we supported a charitable cause. And that in terms of areas of improvement in the future, people wanted to see more info on practice models, how different regions might have different practice styles and billing models. And then people also wanted longer access to the recordings. So at the time of this feedback, our recordings was for 2 weeks long, but we've actually extended them to 1 year so people could have longer time to watch them. And then finally, people also wanted some of the pre-reading from the conference as resources to be sent earlier.
So with any study, there's always some limitations to be considered. So first and foremost, we're doing a lot of self-reported questionnaires. So sometimes we're asking about people's financial literacy, and naturally, without testing their literacy, it's hard to gauge how accurate that may be. There is going to be a limited scope because we're trying to sort of crowdsource experts from our own communities. The kinds of topics that we're able to offer are therefore going to be limited by the kind of expertise that these folks are bringing in. And so, we may not always be hitting the level of financial literacy that people are hoping for. In terms of the impact, we are looking at pre and post-conference questionnaires, but we don't actually have any longitudinal follow-up. So it's hard to say how things are going to evolve or how people's learning has changed their practice over a longer period of time, naturally. So just as I've said that, we're limited to the expertise of our colleagues, at the same time, because we're in Ontario and we're drawing a lot of experts from Ontario, it means that it's also going to be a bit more regional specific. Now, obviously, there are different laws in different provinces, there's different billing codes, there are different consideration and practice variations as well, so that Ontario-centric nature of the knowledge right now is a bit of a limitation. And it also limits our externability to a degree. So we're piloting this and developing this in Ontario, which means that the information coming from it may not be necessarily appropriate to a medical student in Dalhousie, for example. And so that's something that we're continuing to work on as well.
Finally, I also wanted to share the philanthropic impact of the PFI conference. So here we teach debt repayment, investing, retirement, but we also set an example for giving back. So using the proceeds, we've established the Equity Award, which is an endowment fund for a medical student with financial need who also develops initiatives to level the playing field for other medical students with high financial need. And we also want to thank our partners, Dr. BC and Para, for supporting our conference and for partnering with us to deliver financial content to its members. If you want to learn more, please visit our social media as well as our website. And thank you very much for attending our talk today.